Hello friends, welcome back to Friend of Health. So today in this video we'll be discussing most important 100 MCQ points in OBG, which is a rapid revision for any of your competitive exams like AIAPGET, UPSC, PSC. Okay, so these points are more of like MCQ pointers. So make it a point that you have to write down each points. It would be single points. So let's start today's video. So the first one is the pregnancy can be diagnosed. The pregnancy can be diagnosed by USG as early as by. So the pregnancy can be diagnosed by USG at earliest by. So this question meant to say about gestational sac. So you all know about gestational sac. It is one of the important point that always repeats in most of the competitive exams. So this is by 5th week of gestation. Okay, 5th week of gestation. Remember about this kind of each certain weeks like cardiac activity or in such each chronological order you have to remember. So pregnancy can be diagnosed by USG as early as by 5th weeks of gestation, and this includes the visibility of gestational sac. Next one is the longest part of fallopian tube. So longest part of fallopian tube. What is the longest part of the fallopian tube? It is ambula. So we know the parts of fallopian tube like intramural part, interstitial part, then ambula, infundibulum. So intramural is around 1.25 centimeter. Isthmus is about 3 to 4 centimeter. Then we do have our ambula, that is 5 centimeters. So this is the longest part of fallopian tube. Next one is most common cause of death in CA cervix. Most common cause of death in CA cervix is renal failure. Renal failure. This kind of most common questions usually come. Please make it a point that you write down each of these points in a single place. Then most common ovarian tumor which undergo torsion. Okay, so most common ovarian tumor which undergo torsion is mucinous cystadenoma. Mucinous cystadenoma. Now I'll just summarize this important types of ovarian tumor, because this you will get at least one question either from the types or either from the complications or from the benign or the malignancy and its complication. Okay, so when we come to the benign type, one second. So you know that we have benign and malignant type, right? So under benign you have certain types, like I'm not giving you whole types, but just remember we have benign and malignant type. Under benign we have serous cystadenoma, mucinous cystadenoma. So our question is about the most common tumor that undergo torsion. So mucinous cystadenoma is the benign type. Then you have Brenner tumor. Then under malignant you have serous cystadenoma, serous cystadenocarcinoma. This is the most common malignant tumor. Most common malignant tumor is serous cystadenoma, serous cystadenocarcinoma. Then comes mucinous cystadenocarcinoma. Mucinous cystadenocarcinoma. Okay. Then we do have endometrioid carcinoma, clear cell carcinoma, transitional cell carcinoma, clear cell carcinoma, endometrioid carcinoma. Then you have transitional cell carcinoma, undifferentiated. Okay, so this is about epithelial tumors. So epithelial tumor, and so the general classification is epithelial and germ cell tumor. So remember, under epithelial tumor you have the serous, mucinous, Brenner's, and these three are benign, and these are the malignant type. Then germ cell tumors. Germ cell tumor. Under germ cell tumor you have benign germ cell tumor. It includes mature cystic teratoma. This is only benign tumor that you have is mature cystic teratoma. And under malignant you have dysgerminoma, then immature teratoma, then endodermal sinus tumor, then choriocarcinoma, and mixed germ cell tumor. Okay, so next one is sex cord tumors. So this include granular cell tumors. So this is the next type. Once more I'll tell you. So far we discussed about epithelial tumors. Epithelial under we have studied about benign and malignant. Second type is germ cell tumor. In that again we discussed benign and malignant. Now comes the sex cord tumors. Sex cord tumors have granulosa cell tumors. So you know call Exner bodies on histology, that is seen in granulosa cell tumors. Then Sertoli Leydig cell tumor. Sertoli Leydig cell tumor. Then you have thecoma fibroma. Okay, so this much is very important. Make it a point that you're thorough with the types. You will get questions like which among the following is a type of germ cell tumor, which among the following is a type of epithelial tumor. So revise this part very well. Okay, so that's about tumors of ovary. Now next question is precocious puberty is found in tumor of ovary. So yeah, this is also about one tumor. So germ cell tumor you will get precocious puberty. So precocious puberty is one of the characteristic sign of one of the ovarian tumor. So germ cell tumor. So germ cell tumor comes under granulosa cell tumor. So granulosa cell tumor. Precocious puberty is seen in granulosa cell tumor. So granulosa cell tumor comes under sex cord stromal tumor. So from the sex cord stromal tumors and precocious puberty, both are interrelated, right? So it is related to more of sexual function. So under that you have granulosa cell tumor. Next one is strawberry vagina is seen in which condition? Trichomonas vaginitis. So very easy, Trichomonas vaginitis. Strawberry vagina. So strawberry vagina is seen in Trichomonas vaginitis. Then first stage of labor. Be thorough about the stages of labor. So you know the onset of true labor pain till the full dilatation of cervix, right? So till the full dilatation of cervix. So second stage, you know, so you should know the duration of labor also. So second stage, you know, from the full dilatation till the expulsion of the baby. Then from the expulsion of the baby till the expulsion of placenta. Fourth stage is 1 to 4 hours, the postpartum stage. Okay, relaxation stage. So this is about the stages of labor. Next one is hydatiform mold is a disease of. Hydatiform mold is a disease of chorion. Amnion and chorion, the part of placenta, remember. So you should know about the placenta and the parts and important cells of placenta, etc. So hydatiform mold is a disease of chorion, and make it a point that you study different types of hydatiform mold. So you know it is a gestational trophoblastic disease, right? So few points I'll tell you. So hydatiform mold, you have complete mold and incomplete mold. So under complete mold, it is diploid. So 46XX is the chromosomal pattern, and incomplete the chromosomal pattern is 69XXY. 69XXY. So in complete mold, you will get snowstorm appearance. So at least this much you should remember. Rest of the thing, please do revise. I've just recollected the important points. Now, most common site of tubal pregnancy. In fallopian tubule. So in fallopian tubule, most common site of tubal pregnancy is what? It is ambula. Again ambula. So ambula is the longest part of fallopian tube. You will get the most, and it is also the most common site of tubal pregnancy. Then OCPs are not contraindicated in DUB. So you should know the absolute and relative contraindications of OCP. So you have absolute contraindication like history of thromboembolism, hypertension, then breast cancer, liver disease. All these are absolute contraindication. Even migraine, smokers more than or equal like 35 years old or above 35 years old, and undiagnosed abnormal genital bleeding is also an absolute contraindication. And relative contraindication is controlled diabetes, controlled hypertension, not diabetes, controlled hypertension, gallbladder disease, diabetes with complications, migraine without aura, obesity, sickle cell disease, etc. Okay, so these are the relative complications. Now coming to the next question. So we were discussing about OCP, and the question was what? Which one of the following is not a contraindication of OCP, right? So DUB is the answer. Now, so now comes a hormone which is very essential for ovulation and is required from 12th to 14th day of menstrual cycle. Very easy, LH. The hormone of ovulation, right? Then next comes phagocytic cells of placenta are Hofbauer cells. This had repeated many times. This had been asked for many exams like UPSC. Then commonest cause of antepartum hemorrhage, placenta previa, right? Placenta previa. So placenta previa, you should know the types of placenta previa. Like what is placenta previa? The placenta is implanted in the lower pole of uterine segment, right? So in the placenta is implanted in the lower uterine segment, and the types you have type 1, that is minor. Then you have type 2, marginal, and type 3 is partial, type 4 is complete. So remember the types and see how it is, like whether the cervical os is covered or not. So that's important. So major placenta previa is type 3 and type 4. The partial and complete. Minor is type 1 and type 2. Remember these points. So the bleeding will be what? Painless, bright vaginal bleeding. And this occurs after 28 weeks of gestation. Soft, non-tender uterus. Then you will have fetal heart rate will be usually normal. So that's about placenta previa. Next comes commonest type of fibroid. So commonest types of fibroid is intramural, right? So you know the types of fibroid, right? So fibroid is an important question. It is also known as leiomyomas. And benign, it is a benign tumor of smooth muscles of uterus. So this is an estrogen. All these are important points that had been repeatedly asked for exam. Like they will give you different point and they will ask which among the following is correct. Like A, B, C, D points will be there. That's why I've just picked all this point. So it is an estrogen dependent tumor. That means it is mostly seen in reproductive age. Okay, all these points are important. So you have intramural. Within the mural means what? Within the myometrium muscle wall, and subserosal just beneath the serosa, then submucosal, pedungulated, cervical, parasitic. Okay, all these are just basics about fibroid. You will get questions from this. Then you have Figo classification of submucosal fibroid. Just remember, don't study all the types. Just Figo classified which among the following of fibroid. So submucosal fibroid has classified by Figo. So this is important in infertility and hysteroscopic examination. Okay, so severe menorrhagia is seen in submucous fibroid. So it will be giving in like complications like infertility and miscarriage. So that's about fibroid. Now amniotic fluid is maximum at 36 weeks of gestation. Okay, amniotic fluid is maximum like in the 36th week of gestation. Then comes So amniotic fluid, the straw colored amniotic fluid, the color of amniotic fluid, and what is the normal level of the amniotic fluid index, or then polyhydramnios, all these points are important. So at 12 weeks, amniotic fluid will be around 50 ml. This point I'll tell you, then rest of the point please do refer. 20 weeks it will be 400 ml, then 28 weeks it will be around 800 ml. 32 to 36 weeks it will be around 800 to 1000 ml. At term it will be around approximately is equal to 500 to 800 ml. Okay, so the composition of amniotic fluid, electrolytes, proteins, urea, etc. And surfactant is also one of the content. Remember, it is important for the lung maturity of the fetus. Now, commonest cause of antepartum hemorrhage we just discussed. Now, another question from the ovarian tumor itself. Most common complication of ovarian tumor is torsion. Most common complication of ovarian tumor is one of the favorite question for all the examiners for any competitive exams. Please study all the points. So duration of third stage of labor. See, this is also repeated question. So I told you should know every points about the stages of labor. Duration of third stage of labor is 15 minutes. Vaginal infection in children is due to lack of estrogen. Right? Now, next question. Blood returns from fetus to the placenta via umbilical artery. So, how many umbilical arteries and umbilical veins are there for a fetus? Remember, this is very, very important. Remember like this mnemonic is important. AVA. So you have 2 artery and 1 vein. So AVA. Don't forget this. So 3 vessels are there, 2 umbilical arteries and 1 vein. So the blood returns from the fetus to placenta through umbilical artery. So fetal blood flow through the placenta is 400 ml per minute. So this is important. The fetal blood flow through the placenta is 400 ml per minute. Next is peak level of progesterone is at 22nd day of menstrual cycle. Peak level of progesterone is at when 22nd day of menstrual cycle is the peak level of progesterone. Now, diagnostic test of Treponema pallidum in pregnancy is FTA test. Okay, FTA test. Then Ventouse is not used in fetal distress. So Ventouse is not used in fetal distress. Ventouse is not used in fetal distress. Then hepatitis, more common in pregnancy. This had been asked many times. So hepatitis in pregnancy, please read much about this. Hepatitis, more common in which type of hepatitis? More common in pregnancy is hepatitis E. Okay, hepatitis E. See, hepatitis B is the only DNA viral hepatitis. So remember this, all other hepatitis are RNA virus. Then a female complaint of nodular area in upper outer quadrant of breast with cyclical pain. So what will be the diagnosis? Fibrocystic disease of breast. Okay, so fibrocystic disease of breast is the condition over here. Then the best method for diagnosis of endometriosis is laparoscopy. Okay, so laparoscopy. Then marker of CA cervix. Okay, that is, marker of ovarian CA. Marker of ovarian CA is CA 125. So the CA markers are important. OCP increases the risk of breast cancer. That's why it is absolute contraindication. Then amniocentesis can be done after 15 weeks. Amniocentesis can be done after 15 weeks. Next one. Earliest sign of pregnancy induced hypertension, that is rapid weight gain. Rapid weight gain is the earliest sign of pregnancy induced hypertension. This is very important. Then most common type of female pelvis is gynecoid. So now we have covered almost 36 questions. Now comes face to pubis delivery is common in anthropoid pelvis. Okay. Deep transverse arrest is common in android pelvis. Most common lie is longitudinal. Most common lie is longitudinal lie. Then most common presentation is vertex. Most common heart disease in pregnancy is mitral stenosis. Most common heart disease in pregnancy is mitral stenosis. Most common congenital heart disease during pregnancy is AST. According to WHO, anemia in pregnancy is defined as hemoglobin less than 11 gram per dl. Don't get confused by 10 gram. The answer is 11 gram per dl. Now comes most common causative organism of puerperal sepsis, that is streptococci. Okay. Then karyotype in complete mode, that I have discussed, 46XX or 46XY. Then comes in partial mode or incomplete mode, it is 69XXY. If it is triploid, if it is tetraploid, it will be 99XXY. Okay. Risk of choriocarcinoma is more common in which type of hydatidiform mole disease? It is in complete mode. Okay, so complete mode will have the risk of choriocarcinoma. Most common cause site of metastasis from choriocarcinoma is lungs. Now, when combined duration of first and second stage of labor is more than 8 hours, it is known as prolonged labor. So you should know the difference between prolonged labor and preterm labor, like the time, etc. So first and second stage, if it is more than 18 hours, it is known as prolonged labor. Then the onset of labor is less than 37 complete weeks from the last menstrual cycle, then it is known as preterm labor. Okay. Now about symmetrical and asymmetrical IUGR. So symmetrical IUGR is result during third trimester. So in symmetrical IUGR, there will be congenital infection and first trimester. Asymmetrical IUGR is seen in third trimester. Symmetrical IUGR is seen in first trimester. Here you will have the brain is spared. Here brain is also involved. Okay, so the IUGR, the child's brain is spared in symmetrical IUGR. So in asymmetrical IUGR, the brain is spared. So in symmetrical IUGR, the congenital infections, etc. will be there. Now, straw-colored amniotic fluid is normal. So normal color of amniotic fluid is straw-colored. Now, early deceleration or fetal heart monitoring indicates head compression. So I'll tell you one mnemonic to remember this: deceleration, acceleration, etc. So remember VEAL. CHOP. So we were discussing about early deceleration. So head compression, fetal head compression or hypoxia. So hypoxia, due to a head compression, you will get hypoxia. So variable, this is cord, any issues with the umbilical cord. Acceleration is normal and late is due to placental insufficiency. Remember this. Okay. So here this is always been repeated for many questions. So variable deceleration is for cord compression or any issues with the umbilical cord. Early deceleration due to hypoxia or head compression. Then A is acceleration, that is normal. Late deceleration, that is due to placental insufficiency. Okay. Then single best parameter for estimation of fetal age in second trimester is biparietal diameter. Okay. So biparietal diameter is a single best parameter for estimation of fetal age. So fetal age estimation in second trim is with the help of biparietal diameter. Next one is Picard's regime. Picard's regime. So what is this? It is a protocol used for testing convulsions in eclampsia. Picard's regime. So magnesium sulfate protocol. This is known as magnesium sulfate protocol. So this is being done in convulsions for treating. This is a treatment in convulsions in eclampsia. So magnesium sulfate is basically given in this. Okay, this is used for treating convulsions in eclampsia. Next come severe postpartum hemorrhage, shock or infection leading to anterior pituitary necrosis. After anterior pituitary necrosis, there will be postpartum hemorrhage and shock. This syndrome is known as Sheehan syndrome. Okay, Sheehan syndrome. Toxoplasmosis disease is more severe if transplacental transmission takes place during first trimester. So toxoplasmosis disease is more severe. Okay, during transplacental transmission occurs in which trimester? During first trimester. If combined duration of first and second stage of labor is less than 2 hours, it is known as precipitated labor. If it is more than 18 hours, it is prolonged labor. If it is less than 2 hours, it is precipitate labor. Next comes value of HCG, maternal serum and alpha fetoprotein, and estriol in triple test are raised or low in case of Down syndrome. So in case of Down syndrome, this will be low. Which will be low? So HCG will be raised. This both will be low. Okay, remember. So value of HCG will be increased. This is very important. This had asked for many exams. So HCG will be increased in Down syndrome. Maternal serum alpha fetoprotein will be decreased. Then estriol also will be decreased. So this is the parameters that is being tested in triple test. Okay. Then halo sign of dual radiolucent halo around fetal cranium due to edema of pericranial fat suggestive of intrauterine fetal death. Okay, halo sign or there will be radiolucent halo around the pericranium of the fetus. HELP syndrome is a complication of preeclampsia. So what is HELP syndrome? The full form of HELP syndrome is hemolysis, elevated liver enzyme, low platelet count. Okay, hemolysis, elevated liver enzymes, low platelet count. This is seen in preeclampsia or pregnancy induced hypertension. This is also known as pregnancy induced hypertension. Hesse's rule. Hesse's rule is employed for gestational age of the placenta, okay, of fetus. So Hesse's rule is for gestational age of fetus. Next one is, if the umbilical cord is attached to the margins of placenta, then it is known as battledore placenta. So the lemtus placenta, battledore placenta, all these are the type of placenta based on the attachment of the umbilical cord. If it is attached, the umbilical cord is attached to the margins of placenta, then it is known as battledore placenta. Then in bacterial vaginosis, there is one characteristic cells that is known as clue cells. Then crystals seen in hilous cell tumor is Reinke's crystals. Okay. Then next comes signet ring appearance is seen in Krukenberg tumors. Signet ring appearance is seen in Krukenberg tumor. OCPs are protective against malignancy of ovarian CA and uterine CA. Okay. Then most common site of fertilization is ambula. Then decidua is the endometrium of pregnancy. So endometrium of pregnancy is known as decidua. Okay. Then hormone which maintains corpus luteum of pregnancy is HCG. So hormone which maintain the corpus luteum of pregnancy is HCG. Maximum HCG is seen in 60 to 70 days of pregnancy. Normal fetal scalp blood pH is around 7.35. Then expected date of delivery is calculated using the formula that we use is known as Nigler's formula that you know. Now, painful vaginal bleeding in the third trimester may indicate abruptio placenta. This will be painful and placenta previa is painless. So, abruptio placenta includes the painful vaginal bleeding. So, next question is, during lactation period, post-delivery ovulation occurs after 6 months. Okay, the post delivery lactation, during lactation period, the post delivery ovulation takes place after 6 months of delivery. Next comes expulsion of grape like vesicles per vaginum in pregnant ladies suggestive of molar pregnancy, identiform mole. Okay, implantation begins at 6th day of fertilizations. Okay, next one is earliest sign of intrauterine death is gas in large vessels. Okay, frog eye appearance is seen in anencephaly. Then shortest diameter of pelvic cavity. The shortest diameter of pelvic cavity is interspinous diameter. Okay. Next one is Burns-Marshall technique is used to deliver after coming head in breech. Okay, so the Burns-Marshall technique is used in breech delivery for the after coming of head. Next comes AFP levels are decreased in downs, that we have discussed. Then type of ectopic pregnancy that commonly rupture, that is ischemic delivery. Then most common cause of pyometra is carcinoma cervix. Longest diameter of fetal skull is mendovertical. Then most common cause of postpartum hemorrhage. Antepartum hemorrhage we have discussed. Postpartum hemorrhage is uterine atony. Then late deceleration is due to uteroplacental insufficiency. We have read the wheel chop, the mnemonic to remember the insufficiency, that the acceleration deceleration difference. Okay, so it is the late deceleration means uteroplacental insufficiency. Peak level of HCG is 60 to 70 days. Total iron requirement in pregnancy is 1000 mg. Neurological defect in a newborn of diabetic lady is caudal regression syndrome and spina bifida. Neurological defect in newborn of a diabetic mother, caudal regression or spina bifida. Then LH surge occurs before ovulation, 24 hours before ovulation, 24 to 36 hours before ovulation. Okay, LH surge occurs. So a sure sign of labor is formation of bag of water. Sure sign of labor. Sure sign of labor is formation of bag of waters. Then fetoplacental circulation is established by 20 to 21 days after fertilization. So the chronological events that takes place after fertilization, please remember after like first month what happens, do the first week what happens, when is morula, when is blastula, what is the cell stage of morula, etc. Fetal growth is maximally affected by insulin. So fetal growth is maximally affected by insulin. Uterine blood flow at term is 500 to 750 ml per minute. Next comes appropriate time for chorionic villus sampling is 10 to 12 weeks. Immunoglobulin that crosses placenta is IgG. Epithelium of fallopian tube is ciliated columnar epithelium. Ciliated columnar epithelium is epithelium of fallopian tube. Most common heart disease associated with pregnancy, mitral stenosis. Then here, variable deceleration is fetal heart monitoring is suggestive of cord compression. Okay, we studied about the wheel chop. Most common type of compound presentation is head and hand. Most common cause of uterovesical fistula in India. Uterovesical fistula in India is obstructed labor. So the most common cause of uterovesical fistula in India is obstructed labor. Okay, now comes the next question. Most common germ cell tumor of ovary is dermoid cyst. Okay, so dermoid cyst is the most common germ cell tumor of ovary. Next one, embryo is called till the age of, so till the age of after fertilization, till which age or till which week the fetus or the zygote is called as embryo? It is at 8th week. Till 8th week it is known as embryo. Earliest conclusive evidence of intrauterine death is intra-aortic gas. Intra-aortic gas is the earliest conclusive sign. Okay, earliest conclusive evidence. Okay, then the earliest radiological sign and evidence you should know. So the conclusive evidence is intra-aortic gas, and the radiological sign is Spalding sign. Okay, remember this. Next comes hormone responsible for decidual and area stellar reaction of ectopic pregnancy. So decidual and areas cellular reaction of ectopic pregnancy is progesterone. So the hormone responsible for decidual and area cellular reaction, that is known as, that is by progesterone. Oceander sign is seen in pregnancy during which week? During 8th week. And what is it? The pulsation of lateral fornix of vaginal wall. So pulsation in the lateral vaginal fornix. That is known as Oceander sign. Oceander sign. This is seen in 8th week. Pulsation in the lateral fornix. So the weight of normal uterus is around 45 to 60 gram. So the last question is, Schiller dual bodies are found in endodermal sinus tumor. Endodermal sinus tumor includes Schiller dual bodies. Okay. So thank you all. So these are the important, I think I have covered 100 plus MCQs. So please revise these points. This is very, very important. Okay. Yeah. Thank you all.